Hi, folks. Welcome to this week's lecture. Sorry, got a bit tongue-tied there on recruiting participants. So as the title suggests, this week we're going to talk about that kind of critical moment of recruiting people into your study and some of the decisions that go into deciding who to recruit and how to recruit those individuals. This lecture will follow pretty closely to the textbook for those of you who have read there. And so I'll keep it pretty short and brief and simple so that you have enough time to do the readings and also think through these things kind of on your own with regards to your project, because I know many of you are working hard on that. So there are kind of three ways to recruit people. You can do a census, where that's basically just recruit everyone in your population of interest. And so if you're doing a survey amongst, say people who use drugs, you would recruit everyone in everyone who is a person who uses drugs. You'd have to, of course, have some sort of eligibility criteria to define what that means. Is that they used in the past 6 months? Is that they use certain kinds of drugs, or do alcohol and nicotine and caffeine count? So obviously that's defining that population can be tricky. But a census is, yes, you recruit everyone. Oftentimes, as you kind of guess, the census is very difficult, if not impossible, to collect. And therefore, we rely on sampling. Now, sampling is where you try to get a subset of your overall population of interest. And there's two basic ways to do that. There's the probability sampling method and the purposeful sampling method. Now, probability sampling is simply that everybody has kind of an equal probability of selection. Now, probability sampling, due to two main issues, is rare in both evaluation and research work. The first kind of issue arises from what we call non-coverage. Now, non-coverage is basically that you don't have the ability to reach, at least randomly, you don't have the ability to reach every single person in your population of interest because they're probably not included in a sampling frame. Using the example of people who use drugs, you could imagine that it's very difficult to have a list of everyone who uses drugs, and therefore, how would you randomly select people within that group? So that's potentially the first sort of issue with non-coverage. And then there's the second issue of non-response. And so you can think of non-response as when you invite somebody to participate, do they participate or not? Now you can imagine that any number of factors could contribute to a person's decision to participate in a study. This includes things like honorariums, how much money you give them to participate, to cover things like childcare costs and time off work and all the necessary things that might come with the responsibility to I guess I shouldn't use the word responsibility, but come with the I can't think of a word right now, but come with the task of completing a survey. And because of that, because of those two main issues, we often rely on what we kind of call purposeful sampling, which is a nice way to say non-probability sampling. When you think of purposeful sampling, there's kind of two things to consider that a random sample kind of aims to achieve, and that's accuracy and precision. And so accuracy basically refers to how close measurements are to the true or accepted value. And so you can kind of see that in the picture below that figure C and D are accurate in that, if you take an average of all those measurements of where those arrows are, if you were to do latitude and longitude and then average those all out, they would be pretty accurate in that they were all pretty close together. I know that's a little bit weird for C, which is why it's also important to recognize the importance of precision, because precision refers to how close measurements of the same item are to each other. And so if you were to sample a population 1, 2, 3, 4, 5 times, how close together would those be? And so accuracy and precision, if you have a sample that is an accurate reflection and precise reflection of the real population, then your sample statistics are going to be good measurements of your population parameters. As earlier in one of the chapters, I can't remember which one right now, but we talked about population parameters being, those things relevant to population. So, how many people caught the cold last year? and sampling statistics are, the prevalence of people in your sample who got the cold. And so when your work has this element of accuracy and precision, when your study does, then that means that you can generalize it to the population that you're trying to generalize it to, because it's a basically a good reflection of that population. And so this raises kind of a critical issue that when we think of evaluation work in particular, and also to somewhat lesser extent research, you have to consider who you're trying to represent. What populations are you trying to represent? If you're conducting a study in a clinic setting, for instance, then you want to evaluate the efficacy of your program among those people who participate in your clinic. And so you can certainly use probability sampling methods on occasion, especially if you're part of a really big program evaluation. But sometimes maybe it doesn't make sense to randomly sample people because, say there are 15 participants. If you randomly sample, basically you're going to be sampling the whole population. And so you're kind of conducting a census. And so in thinking about probability sampling and non-probability sampling, there are a variety of different ways in which you can interact with the population. And so let's first review the probability sampling methods. And so that includes like a simple random sample. And so this is, you give every person a number and then you draw it out of a hat, or you have a random numbers generator, or you do something to basically pick each of those each person based on their number. And so that's just simple random sampling. Every person has a number, and then you select those numbers randomly. The next option is stratified sampling. Stratified sampling is basically you divide the populations into groups, and then you assign each person within each group a unique number, and you randomly select. And so that's usually important for, say, you're looking at something like ethnicity, or you want to make sure to capture a specific phenomenon of interest. Then sampling a certain number of people within each of those strata, those stratified groups, that's what it's called. It's called a strata. Then you allow to randomly select within those. You see, with stratified sampling, just like with simple random sampling, every person in the population has kind of an equal probability of selection within their strata, whereas in the simple random sampling, they have an equal probability of sampling overall. And so, so stratified sampling allows you to get that. Still doesn't violate the assumption of kind of a probability function. The next one is cluster sampling. Cluster sampling is basically, again, to make sure that everyone has an equal probability of selection. First, you randomly select what we call a cluster. So the classic example that you always get with this one is like school districts. And so if you were to go into a school, you'd randomly select a school district, then maybe you'd randomly select schools within that school district, and then you'd randomly select participants within that school. And this is called cluster sampling. Again, you still have to make sure that at each strata or each cluster, at each level of the cluster, that people within that level have an equal probability of selection. Next is multi-stage sampling. That's simply, you can mix and match any of this method. So maybe first you stratify the population in groups, and then you look at the clusters. So let's take ethnicity as an example. If your strata are ethnicity, so you might recruit like white, African, Caribbean, Black, Asian, South Asian people. And then within each of those ethnic categories, you might say, well, we're going to cluster, the cluster we're going to select is maybe families or church communities or, YMCA participants, or, whatever the case is going to be. And so you can mix and match those. And as long as it's random at each level and random within each strata, then you've got a multi-stage sampling strategy, which we consider kind of a probability sampling method. And then finally, there's systematic random sampling. Systematic random sampling is probably the most similar to simple random sampling. But instead of kind of assigning each person a unique number and randomly selecting that numbers like you do in simple random sampling, instead you just make a list of people and you randomly select every kth person. So you select a random number, say it's every 7 people. So every 7th person on the list, you would include them. And so if I can stress anything with probability sampling, it's the fundamental principle that people need to have an equal probability of being selected into the study. And so anytime you're deciding on a factor or variable that's going to influence who gets recruited, you have to make sure that that's a random event, and that that randomness isn't weighted to be more likely to recruit one person or another. Now, this is pretty important if you think about it, because it means all of the characteristics of an individual are also going to be kind of randomly selected. Kind of like if you randomize a case control study, you randomly distribute the potential confounders. That same thing with your recruitment method. It makes sure that if your recruitment method is random, then it's unlikely that the method of recruitment is going to bias your outcome or exposures. But of course, as we kind of mentioned, it's not always feasible, and oftentimes very few studies are actually probability sampling studies. You think of even the best methodology that's out there are sometimes like random digit dialing on telephone, but even those are often not random because not everyone has a telephone, and not everyone who answers their telephone for a telemarketer completing a survey is actually going to, be willing to complete that survey. And so thus we rely on this big body of non-probability sampling methods. Now, I'll quickly run you through these as well. Suffice it to say that it's important to select a method that meets the needs of your study to get at what you're trying to do. And so I find that these non-probability sampling methods are actually really useful in terms of qualitative research or in terms of conducting an evaluation. The first is quota sampling. So if I wanted to, say, conduct focus groups, and the quota that I create up is this, I want 5 nurses, and so I recruit until I have 5 nurses. I have 5 doctors, I recruit until I have 5 doctors, and I want 25 patients. I recruit until I have 25 patients. And so you see a random sample probably would have not given me a distribution of 5, 5, 25, right? And so quota sampling makes sure that you can get certain populations of interest. And so another example of this might be like ethnicity in a community-based survey. Yeah, if you survey people in BC, maybe 2/3 of them are going to be white, but you want to make sure that you actually have a better representation so you can actually conduct meaningful research in other populations. If you're working in Richmond, for example, you might need to adjust for the demographics on the ground and make sure that you're recruiting the right populations of interest. If you're in Surrey or Vancouver, all of your quota samplings are going to be a little bit different. But if you wanted to, if you set a quota saying, no matter what, we're going to recruit this number of people, then you can achieve that. And so that's helpful analytically. The key here is to make sure that the way you're recruiting or who is getting selected in your study, that your sampling method doesn't act as a confounder. A confounder, remember, is something that is associated with both the exposure and the outcome. And so if you're recruiting in a way that does not prioritize recruitment of one population or another, then it's probably okay that it's a non-probability sampling, and therefore any of these sampling methods will work. The next is convenience sampling. Convenience sampling is pretty traditional. A lot of convenience samples are conducted among university students because that's where a lot of research takes place. But you can imagine in a clinic setting, just everybody who comes into a clinic on a specific day gets recruited. There's self-selection sampling, where that's where you put a poster up or you put an ad up somewhere, and then you allow people to contact you and inquire about joining the study. Again, that may potentially be a confounder. People have certain motives for participating in study, and you have to make sure and think through how is that actually going to influence your results. Snowball sampling is where you rely on the social networks of people. A modified version of snowball sampling is called respondent-driven sampling, and respondent-driven sampling actually uses a statistical weight to infer something about the network based on the pattern of recruitment among individuals, and it adjusts for people's network size, because if you have a larger social network, you're more likely to get recruited into a snowball sample. And it also addresses for the natural, what they call homophily, the natural degree to which 2 participants who would potentially recruit each other share the same characteristics. And so this respondent-driven sampling is a great method because it allows you to take a snowball sample and make it a little bit more independent so that it approximates better a probability sample. As with all of these, there are many offshoots and variations and statistical approaches to try and improve upon these sampling methods. And so they're probably beyond the scope of this course, and probably for most evaluation work isn't going to be totally relevant. Mostly weightings and those sort of things really occur in big epidemiological studies, and not really the sort of the sort of research methods that we cover in this course. Then there's maximum variation sampling. So this is really beginning where the purposeful sampling methods start. And so with maximum variation sampling, your goal is to recruit as many different people who are as different from each other as possible, so that you maximize how much of the population's experience you're capturing. And so you want to make sure that you're capturing the diverse experiences of people who participate, and therefore maximum variation sampling is a great way to do that. But sometimes maybe you want to do homogeneous sampling, and homogeneous sampling is kind of the opposite of that, is you want to recruit people who are like each other. And so you could think of this as something like, maybe you want to conduct a survey about nurses who work with children. And so you would do a homogeneous sampling method where you're really only recruiting nurses. Maybe you have like a number of criteria, nurses who have been nurses for at least 10 years, but no more than 30. So you put all these constraints on it to make it as homogeneous a sample, so that you can really understand well that specific type of experience. And so you could imagine this would be really important, say a demographic intersection, such as you want to look at Indigenous women with raising children or something like that, to understand kind of that process, that experience, and understand how your program relates to that population. And so homogeneous sampling can be a good way to dive deep, to look at specifically one type of experience that might be a very important experience to your research. Kind of in between these two is what we call a typical case sample. A typical case is, if you're running a business or you're running a hospital or a clinic, you want to get the experience of the typical person who would walk through the door. And so that's important. You can imagine for marketing campaigns, that sort of thing, where you don't necessarily want to shape a program or shape information by these extreme or deviant cases or really specific cases, but you'd want to just focus on a typical kind of person who walks through your door. And so typical case sampling, again, is you have to have some criteria of what you define typical as, but once you've got that, then you just can seek out and recruit those people. Probably potentially through snowball sampling, you ask people to recruit each other, or through some sort of self-selection sampling. So kind of like as with before, where you can mix and match through the math through in probability methods, you can also mix and match here and say, we're doing multiple things at one time. We're doing, a self-selection sample, but are focusing on, the homogeneous sampling or something like that. The next one is deviant case sampling. And so this is where you want to recruit rare exceptions into your study. And so maybe you're looking at, say you have a treatment study that tends to have a really high success rate. Well, deviant case sampling would just be, you want to see among those who did not have a high success rate, those who dropped out of the program or something like that. You want to see what makes them different. How can we patch up that hole to make sure that people don't fall through the cracks? That's the sort of thing you're doing with deviant case sampling. A critical case sampling is hard to define exactly. I think I would describe it as like key informant interviews, identifying those critical people who maybe have special insight into something. And so if you're, for instance, doing qualitative interviews to improve your clinic's customer service, and one of the areas identified is like booking appointments. And so maybe you talk to the scheduler or the receptionist, and that person is the critical case because they're the person who really has the information that you want to know. And so critical case sampling is a really useful sort of strategy as a way to think about how you recruit people. Then there's total population sampling, where that's often, you could call that a census. Total population sampling is where you want to survey anybody and everybody who's visited the clinic, to get a wide, broad spread consensus. And then finally, expert sampling is where you want to interview those who have special expertise or lived experience, people whose generally whose credentials or something particular about their experience, their lived experience, where that is the thing that you're trying to capture. And so to understand. And so you can imagine anytime you interview with doctors, you might consider an expert sampling. But maybe not all doctors. Maybe there's only very specific key few doctors that you're interested in interviewing. So expert sampling is another strategy. So a lot of these things don't have rough and firm definitions. It can sometimes be hard to tell, is this, what is the motive? I think the way to use these and to think about these sampling methods is to think about how they elicit in your mind what the sort of things you should be, who you should be recruiting into your study to get the information you want. I think that's the most important message of today's lecture and of what is in the textbook is making sure that you're recruiting the right people into the study to get you the information that you need to conduct your analyses and to understand your program. And so this flows right into the assignment for this week, where this week's assignment is to create a recruitment strategy. Generally, most groups will have kind of 3 evaluation activities. So for step 1 there, which is to identify where you'll recruit your participants for each evaluation activity. Generally, groups will have 3 recruitment activities, some form of indicator reporting or data collection through official channels, to see how many people came through the door, how many events did we hold, how many training sessions did we hold. Those are going to be collected, probably not through a survey or anything, but probably through some official form or data collection thing. So most groups will have that in their project. The next thing is most people will have because it's supposed to be a mixed methods assignment or mixed methods evaluation. So some form of qualitative process evaluation and some sort of quantitative outcome evaluation. And so you should identify at least 2 recruitment mechanisms in your study, one for qualitative and one for quantitative outcome evaluation, and describe those sort of things. If you're using another activity that a lot of groups may be doing, if they're doing any sort of impact evaluation, will be relying on secondary government data, such as health records or something like that. In which case, it's important to recognize that is secondary data. You don't need to describe a recruitment strategy for that. You just need to identify the data source when you're discussing that in terms of your analytic plan and that sort of thing. So recruitment strategy, all we're looking for is qualitative process evaluation and quantitative outcome evaluation. How are you going to recruit people? Then, as you do that, we want you to explain how that impact of recruitment, how that impacts your results. And so here's kind of an example of what this assignment might look like. It says, the purpose of our qualitative interviews are to identify barriers of implementation of our new electronic medical record system. So putting the purpose there will help a lot as we look through your specific proposal. But knowing basically everywhere, just reiterate the purpose of why you're doing things, explaining why you're doing things goes a long ways to helping readers understand what you're doing. And then next I say, qualitative interviews will be conducted and blah, 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 blah. That's the white section, basically describes the method. And explaining the impact is here in the blue. It says, we anticipate that this recruitment strategy will ensure that the evaluation team understands the perspectives of a wide range of hospital employees with different levels of interaction and technical capacity for using an electronic medical record system. However, our results may not represent the entire staff, and therefore not all barriers identified through participant interviews will necessarily be representative of the typical experience of hospital staff. Right? You can imagine if I've tried to elicit a broad base of views, some people maybe one person identifies something as an issue, but maybe that's just an issue for them and it's really not an issue for everyone else. Is basically what I'm trying to convey there in the blue. Is saying the barriers that we identify won't be necessarily taken as widespread or as limited, that basically we don't have the ability to say how representative our data will be. And so that's just identifying for the reader what the limitation of your method is and also what the strength is, that you're listing a wide range of perspectives, and that in and of itself has some benefit. The next thing you're going to do is put together a recruitment poster. And so these are 3 studies of recruitment posters that have kind of come across my desk recently. 2 of them are studies I work on. Um, so the first here is you can kind of see a Facebook ad, and if you click that link, learn more, then you'll be taken to the survey. The second is kind of a poster that can hang up from the TransPulse survey, and you can contact them, either visit their website or email them or call toll free to kind of participate in the study. Or this one on the phone, where it's this was put up through a dating app for people who are interested in group sex. And this is about joining an advisory board, and they would just click that screen. You can see that each one provides the level of information appropriate for the type of medium that it's communicated in. And so you can see, for example, on the Facebook ad, there's no phone number or email address to contact people in the survey. And so that's important to recognize, is that really is what we're looking for with your poster is not how good your graphic design skills are or whatever. You can put up a pretty simple, but how appropriate it is for the community or the target population. You can see all of these are designed for gay, bisexual, other men, homosexual men, or trans men and women. And therefore the advertising is appropriate, but also that the necessary information is included as well. So how to contact, what to do on the next step, making sure that your ask is clear. And then finally, for step 4, we do also ask you to create a recruitment email. So here's kind of an example of recruitment email that would be sent to participants at a recent conference, asking them to provide feedback on a survey. Again, that is what we're looking for here, is kind of appropriateness for the population, that it's attractive, that all the key kind of takeaway points are there. Complete this by November 30th. That it's professional, inviting, everything that you would want an email to be. And so that's step 4 of the assignment. And so that's basically the 4 steps. 5th steps is just, as usual, save it as a PDF and have your group members submit it. As you do that, you're going to want to make sure that your recruitment methods are clearly identified, that all the materials are appropriately designed, and that you thoroughly discuss kind of the limitations and I would say benefits, basically the implications. Would probably be a better word than limitations, but the implications of your recruitment strategy. And so that's this week's assignment. Hopefully it won't be too easy. I can't imagine that, the recruitment strategy portion is going to be more than a page. Probably more close to a half page. And then the poster is, poster. You can use, I really like PowerPoint. Word has some good templates for posters. Publisher, there's these other programs. There's Canva, I think, is a website you can use. There's lots of different ways to design the things. We're not looking for your graphic design skills. We're just looking for, is it appropriate? Is it done generally well? And so we're not going to, be super critical there. So don't worry about if your graphic design skills aren't quite what you would hope to see in an actual study flyer. And then writing an email that is a professional, short, gives the information that's needed, and that sort of thing. And so that's this week's assignment. If you have any questions, contact me through the discussion board, and that will be it. And then next week, after this week's material, next week is you'll submit the final proposal, and you'll complete this. You'll complete the quiz 2. Just a note on quiz 2, we'll be providing more information about quiz 2 at the end of next week, and give you kind of information that you need to prepare for the quiz. I think I will also try to develop some study aid material to ensure that everyone kind of knows what's going to be kind of basically on quiz 2, to make that a little bit easier for you. Because I know that right now at the end of the semester, things are really busy, things start to get hectic. And so I want to make it as easy as I can. it looks like most people in the course, I think everyone has an A in the course right now, an A minus at worst. So I think things are looking to be pretty good, and I don't expect the exam to change that much. And I think because you've had all this opportunity to look at each of the assignments individually, as you incorporate that into your final proposal, I also expect that those will be highly scored as well. Somewhere in the 90s would be my guess. So with that, good luck. And again, look forward to hearing from you on the discussion boards as always, and have a nice weekend.